everyone. Let's level up our dementia care by talking about the different levels or stages of dementia. So today we're going to pick up where we left off last time, talking about the Global Deterioration Scale. Or GDS is from the research and work of Dr. Barry Reisberg. He's an Alzheimer's disease specialist, and in it he describes the typical progression of Alzheimer's disease, which can help give care partners some idea about what they can expect as time goes on. And as I explained last time, we have to remember the scale is based on Alzheimer's. And although I see it commonly brought up and applied to other forms of dementia all over the internet and other places, this scale, along with the FAST that we talked about last time, may not line up quite as nicely with your person's signs and symptoms as it does for Alzheimer's disease. But there can be quite a bit of overlap, which is why I think it's helpful to talk about it. But please don't fixate on trying to identify exactly which stage your person is in, because it might not be 100% accurate if there's another form of dementia at play, or if there's something called mixed dementia, which is one or more, or it's more than one forms of dementia in the same person, or there might be another medical condition that is causing different symptoms or an exacerbation of symptoms in your person. So like I said, I still like to talk about the GDS because I really feel that knowledge is power, which is why I do all these videos, right? And having a little bit of knowledge, even though it may not be a complete picture, can reduce a little bit of stress, help us know what might be in store for us, and we can feel more empowered to be prepared and proactive. So the GDS breaks down Alzheimer's into a sequence of 7 stages that outline the typical progression of Alzheimer's disease. So here we have some information about stage 1 and 2. These are the stages we would associate with normal cognitive function in an adult. The slight difference being that in stage 2, a person is going to start noticing some changes, like where did I put my key, or where did I leave my phone? We can all relate to this, right? But it doesn't mean that anything is wrong with us. This is just a normal happening that occurs as we age. In stage 3, or mild cognitive decline, or sometimes we see this described as mild cognitive impairment, or MCI for short, in stage 3, people may begin to have difficulty that would actually show up on a clinical test, like remembering words, or remembering names, or retaining information over a period of time. So we're going to also start seeing people make mistakes in more demanding settings, like a job, or maybe even driving errors. So on this level 3, other people can actually start noticing that something is changing, and most of the time people are aware themselves of these changes. Sometimes there's a lack of awareness, but when people are aware, there can be, number one, quite a bit of anxiety, right? That they're either going to express or keep to themselves when we realize that we're losing some cognitive function. But on the other hand, these people are generally able to compensate quite well for some of their deficits. So they're going to start using calendars or making lists, or using all sorts of other reminders to help them. And they know when they need to employ these strategies. Stage 4, or mild dementia, is where we often will see someone receive a diagnosis of dementia. So cognitive decline is becoming much more obvious. They're going to have clear-cut difficulties with complex tasks, things like traveling alone, paying bills on time, scheduling appointments. They may be prone to financial scams at this point. So people in stage 4, though, still have quite a bit of remaining ability for simple ADLs. So they perform really well with routine tasks in a familiar setting. In stage 4, they know where they are, who they are, but they may start losing track of information. They can make a mistake when they're telling a story, and their recall for recent events may be impaired when they're talking to you. So short-term memory loss may become pretty obvious. As we move on to stage 5, you see that cognition worsens. The person in the moderate phase of dementia is not going to be able to typically recite their address or remember the names of the school they went to, or they might start getting their grandkids' names mixed up a little bit. Sometimes we can see also uncertainty about the season of the year, so you might see them dressing inappropriately, like maybe they'll wear a heavy jacket outside when it's 80 degrees. Then as dementia progresses further into stage 6, sometimes we'll see forgetting the name of their spouse or someone they see every day. They may become unaware of time and have difficulty kind of figuring out what is going on for today, or they may not be able to remember what happened earlier in the day or get that mixed up. In stage 6, they need quite a bit of assistance with those basic ADLs, things like getting dressed, reminders to use the bathroom, reminders to bathe regularly, and assistance might be needed to complete actually all the steps of a task, like wiping themselves or thoroughly bathing, or maybe combing the back of their hair is missed because they're not noticing things now that are not within their line of sight. And finally, in stage 7, which is the final stage on the GDS, people begin to lose their speech. Although we can see speech impacted much earlier on, now people are limited to just a few words. Also, a lot of physical ability is lost. So people are becoming much more incontinent, and often their swallow mechanism is affected. They're losing the ability to walk. So you'll see a lot of people wheelchair bound or even bed bound as stage 7 advances. And at this point, they will need help with almost every ADL, including eating if they're still able to eat safely. And as I go through this, I'm struck always by how devastating this disease or this condition is. And I'm providing information not to make you sad or fearful, but hopefully to help you feel more prepared and proactive about, getting the help that you're going to need as time goes on. So as we wrap up today, I just want to acknowledge again how hard dementia is. But I'm also, I will say, struck by the number of remaining abilities people have, even in those end stages of dementia, to connect with us, like even through touch, like a hand hold or hand massage, or kind of seeing that light of recognition when they recognize a familiar face or a voice or favorite song. It seemed kind of heavy, this topic today. And if you need to pause the video before we continue with our meditation, just go ahead and do that now. But otherwise, well, let's just get comfortable, find your space for our meditation. Let's take a few cleansing breaths, clearing the air. And as you do so, close your eyes and begin to sink a little bit deeper into the surface that is supporting you right now. Become a little more aware of the sensation of that supportive surface. Allow it to hold your back and your core muscles, just allowing you to relax more fully. Just continue with gentle breathing in through your Now drop your shoulders down and away from your ears a little bit, helping the muscles that support your head, your neck, lighten their load. Relax your jaw if it's become tight. Relax the muscles of your forehead, around your eyebrows, and feeling those loosen. Continue to settle lower and lower into a complete state of relaxation. If you become aware of any circulating thoughts, attend to them and allow them to soften, relax, and dissipate. And refocus your attention on a tiny space in the center of your brain. Think of it as a little dot, representing a space deep within your mind that is dark and totally void of all activity. Let's sit here for a few moments, enjoying the absolute stillness of your mind. If any thoughts or sensations become a distraction, just acknowledge them and let them fade for now. Enjoy the peace and quiet of this space you've created for yourself in this moment for a little while. Now that you're settled and are experiencing a little more peace, the challenge, of course, is to carry this with you into life. It's possible to interact with others and to respond to our environment when we're calm and still like this, but it takes a lot of practice because life is challenging. And our emotions are really good at overwhelming us and taking charge. Today, I invite you to become aware when those feelings of irritation, frustration, or even anger come up. And there is no doubt that dementia gives us a massive dose of opportunities to experience and practice this. Sometimes that awareness alone is enough to stop us in our tracks so we can regroup. But other times we may need more physical space before we re-engage. And importantly, let's not be hard on ourselves when we react in a way we're not happy with later on. rest assured there will be lots of opportunities for more practice to work on developing a more peaceful presence within ourselves. Doing this work means you're not only making a contribution to a more peaceful self, but to a peaceful home, and quite honestly, a more peaceful planet. So please linger here a little longer. Refocus attention on the small dots in the middle of your brain and sit here a little longer if you can. I'll see you next time. You've got this.